government to participate and to know what homeopathy is all about. And I am indeed indebted to Dr. Nyanasamandam, who is the governing body member of IHML. If it was not for him, I wouldn't be here. He invited me, and it's a great dais to be on. I also thank and show my respect to Dr. Venkatraman and Dr. Aleem. They are my seniors. We learn from them, we are motivated through them, and I thank you for giving me an opportunity to share what I know in the system of homeopathy today. I also am happy to see so many faces, my colleagues and students who are interested to know something about the system or something new about the system. In a way to handling today is evidence-based medicine. So I'll give you a preview of what evidence-based medicine is and why is it important for today, and then carry you through the whole session. What's the aim of evidence-based medicine? Evidence-based medicine is the need of the hour. The world around us talks about evidence-based medicine. Any scientific community talks about evidence-based medicine. Doctors around us talks about evidence-based medicine. Government wants to show, or us to show them evidence in what we are doing. Everybody wants evidence. So that is the need in our system also. We are lacking in the evidence-based medicine should be there. You show evidence for what you have done. You have taken a cancer case, you have treated a cancer case, you should be alright. Let me tell you an experience when I was in Belgium doing my MD. I did my MD in AM Sheikh, and I would tell you an experience. We had a case of infarct come to us, and in a semi-comatose position. The lady was about 80 years. It was referred from Kali Medical College, and these people came here almost semi-comatose. We gave homeopathic medicine and the patient completely recovered. But the doctors in our institution, the allopathic doctors said, this is not stroke, this is not anything. This is just transient ischemic attack. 24-48 hours, you simply leave it there, give placebo, the person will be alright. What did you do? You didn't do anything. If we don't have evidence, we can't prove what we have done. So that's when we started doing this evidence-based medicine. That's what made me, we need evidence to talk to the other system of medicine and to other people around us. That is one. Then the reliability of the process. When you do anything for the evidence, then the reliability automatically comes along. What is reliability? Reliability is that you can duplicate it once more. You can rely on the way that you took the case, you can rely on the way that you prescribed, you can rely that this has shown differences. That's the reliability. So when you ever continue or this process in your practice, it becomes very important, and it is inevitable to have evidence-based medicine in any one of our cases. The third, to enhance statistical database. In homeopathy, the biggest problem is statistics. If I ask senior homeopaths who are practicing homeopathy for 20-30 years, how many tonsillitis cases you have seen? I can't count them. I have seen many, they would say. Okay, how many migraine cases you have seen? How many cancer cases you have seen? How many autism cases you have seen? The answer would be many. Show me one. How can I show you one? That would be the answer. They would have seen, in reality, they would have seen. They are filled with experiences. But because it is not data-based, you cannot show the public outside what you have done. So the statistical evidence should be maintained, and that is very important wherever it is. Next. 1 minute. Just go back to the next slide.
Previously.
See, it's important in organizations like hospitals and colleges and for individual individuals. Hospitalization basis. Imagine, see it says juvenile myelodysplastic syndrome. So you have a proof that this case is this, and you have a proof that it was done in this lab. You have a proof that it was done by a hematologist. Because from the audiogram we took a month back, which showed a loss of over 106 decibels in both the ear. So about 30 to 40 points decibels have come down in a short time, 1 month's time, which has not been done in 4 years in Niman's Hospital, Bangalore. So is homeopathy doing something?
Yes.
Fantastic, evidence. Show the evidence. Anybody, you, everybody will believe. So who wants to become a better homeopath? Everybody. Very good. Now next slide. Now see, you also have an evidence of what you have done for the case. So you have saved the case here. You see that Jonathan's case will be written there. It's not very clear there. And what are the symptoms we have taken? What are the rubric we have taken? Next slide. And this is my software which I invented in my clinic. This is my software, and then you know what was given, what date was given, 2010, 2011, pulsatilla 1000 below is discussed. They need a lot of medicines now, patients, so we give low dose discussed, enough and more. So look at this, we give this, and look at that, it's written there. Go now, next slide. Now the audiogram is another evidence-based medicine. So you take the audiogram, how much it was, you see here, 106. You see here, 106. Go next. You see here, 60. You see here, 60 and 70. 70. Next slide. So you have an evidence. It's Jonathan's case. Now next, hepatitis C. Hepatitis, look at this. Look at this. Read this. 4,20,000. Enough. Okay. Now what is this? Virus, RNA quantitative virus. Okay. Now look at this. This is Vajravelu. It's done in the immuno lab. Everything here is proof. Okay. Next slide. Look at this. Look at the amount there. How much is it?
3 lakhs.
Okay. Next slide. Is it what is written in that?
Not detected.
Not detected. Finished. Hepatitis C means death. But here you can make it all right, and you have proof of that. So don't be frightened of how severe the cases or how big the cases. Homeopathy is this game for a homeopath. Simple and easy. You can easily do this and show the difference here. But you show proof, everybody else will believe. Okay, next. See the same Vajravelu's case. Vajravelu's case, you have proof what you have given in 11/4/2011. If you go back, you see when you can correlate the dates of the sample. 24/7, go back. 24/7, go back. 24/2, 24/7. Okay, now go down. So you know when is the person really our case? Is the person under our treatment? Everything is here because of our database here. So you know really that you are not duplicating anything, it's true. Now next. Next. Okay, gallbladder calculi. I told you gallbladder calculi? No. Any other calculi you give medicine.
Wow. A great orator is pointed and impassioned. Such was Dr. Dinesh RajKumar's speech today. It was a stunning presentation with a sense of purpose to influence us with a new outlook towards our science with his deep insight of knowledge. Doctor has spoken about evidence-based medicine, which is the fundamental demand anywhere and everywhere for acceptance in first place. Of course, we can't deny that no matter how great is our science, yet there is no much awareness of homeopathy and the other systems of medicine do not accept the value of a science. After all, credibility, what matters, end of the day, anywhere and everywhere. Doctor reflected in his speech that all the homeopathic doctors are anguished and they have the need to tell the world homeopathy is a credible system, and yes, we can do, and we do have scientific evidence to show what we can do. Sir, all of us want recognition, and homeopathy needs to come to the limelight in today's world. So, as we homeopaths treat so many patients, and we should all collect the data, the evidence in all possible ways and show the world what we can do. Shall we all do it? Shall you start collecting all the data possible and the changes we can bring about in patients? Shall we? I think we should start doing it. Yes, we will do it. I request Dr. Jaipriya to come forward and give the memento to Dr. Dinesh RajKumar Samuel. Thank you, sir. Thank you so much, sir.